Hi, my name is Bridget Osisanya, and this is my final head-to-tail assessment for PNE 203. So this is my Seneca ID card. So before I start, I want to do a 360 view of the room. Okay, so right now I'm going to perform hand hygiene. I'm done on clean gloves. Okay, I'm going to wipe my stethoscope. Okay, so this is my patient. I'm going to check his ID badge. Can you confirm your name and your date of birth for me,
My name
please?
is Williams Overton. I'm born December 13th, 1931.
Okay, so I'll provide privacy for my patient. So I want to perform head to toe assessment for you. Is that okay by you?
Yes.
Are you comfortable?
Yes.
Do you want to use the washroom?
No.
Okay, so I've gotten permission from my patient that I will start performing his head to toe assessment. So I'm going to start from his physical appearance. The color of his skin matches his age and his genetic background. I'm going to check for my patient's structure. Can you get up for me, please? Can you sit down, please? Okay, my patient's body structure is erect. He appears nourished. There's no form of any deformity, and also there's no form of any skin odor, and there's no form of masses. So I'm going to check for my patient's behavior now. So his mood, my patient appears to be in a good mood, and my patient is maintaining eye contact. His speech is intact. He's dressed appropriate for the weather, and he does not have any body odor. I'm checking for my patient's work of breathing. My patient does not appear to be in any breathing distress or finding it difficult to breathe. I'm checking for my patient's level of consciousness now. My patient is alert and is awake. Can you tell me the time?
It's 4:30.
Okay, can you tell me your name?
Williams.
Okay, can you tell me where you are?
I'm at the hospital.
Okay, my patient is alert ×3. He's alert to time, place, and person. So right now, I'm going to inspect my patient's head. So in inspecting his head, I'm going to start inspecting his face. So I'm inspecting my patient's face. My patient's face, his head is symmetrical to the body. There is no lesion, there is no lump, there is no swelling, there is no scars, there is no edema, and his head, there is no involuntary movement. So in checking for while inspecting my patient's face, upon inspecting my patient's face, I'm going to check for my patient's cranial nerves, 7 facial nerves. So can you close your eyes for me? Can you open your eyes for me? Can you frown? Can you smile without teeth? Can you smile with teeth? Can you puff your cheeks? So okay, can you keep your cheeks puffed? I'll try and deflate them. Puff it, please. Okay, can you close your eyes for me? Keep them closed. I'll try and open it against resistance. Okay, my patient was able to withstand resistance when I tried to open his eyelids and puff his cheeks. So his cranial nerve 7 is symmetrical and they are intact. So right now I'm going to inspect my patient's eyes. Upon inspecting my patient's eyebrow are symmetrical at both sides. Can you shut the eyes for me? There is no lag of the eyelids. His eyelashes between his upper eyelids and lower eyelids of the hair in between of the both eyes are evenly distributed. Can you open your eyes for me? Okay. I'm going to check for my patient's sclera is white and there's evidence of pink blood vessels. His sclera is white and there's evidence of pink blood vessels. I'm going to check his conjunctiva. His conjunctiva is pink and there's evidence of blood vessels, and his eyes are symmetrical and equal at both sides. So I'm going to check for my patient's pupil size. Can you open your eyes, please? Okay. Okay. His pupil size is 3 on both sides. They are equal at both sides. And I'm going to check for direct and concession to light. Okay. 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 So my pupils, my patient's pupils were dilated. That means it was direct and concession to light. I'm going to check for accommodation right now. Can you look over there for me? I'm going to bring this pen to your nose, so you continue to look there for me. Okay, my patient pupils constricted. That means there was accommodation. So right now, I'm going to check for my patient's ears. Inspect my patient's ears. Okay, upon inspection, my patient's ears are equal to size. The skin color matches his genetic background in every other part of his body. There's no discharge from any of the ears. So I'm going to inspect my patient's nose and sinus. My patient's nose is midline and there's no discharge from the nostrils. I'm checking my patient's mouth right now. Okay, close your mouth please. My patient's lips appears to be hydrated. There is no scarring and his lips his upper and lower lips are symmetrical and there is no lesion or any skin mouth drooping. So right now I'm going to inspect cranial nerve 9 and 10. Can you open your mouth please? Can you say ah? Okay, so my patient's when my patient said ah, his soft palate and his vulva rise. That means his cranial nerve 9 and 10 is intact. Okay, so right now I'm going to check cranial nerve 12. My patient will stick out his tongue for me. Stick out your tongue please. Okay, can you take it side to side? Okay, can you say light, tight, and dynamite? So my patient was able to say light, tight, and dynamite. That means cranial nerve 12 is intact. So right now I'm going to go to my patient's neck and inspect my patient's neck. Okay. Okay, my patient's neck is symmetrical to his body. There is no visible pulsation. There is no swelling. There is no edema. There is no mass. There is no lump in the neck. I'm checking my patient's trachea now. Okay. There's no visible swelling of the thyroid, and there is no evidence of there's no visible pulsation, and the skin color of his neck matches the other part of his body and his genetic background. So right now I'm checking for my patient carotid artery. So I'm going to inspect his carotid artery. Upon inspection, there is no swelling. It's smooth to touch, and there is no swelling, and there's no visible pulsation. I want to palpate his carotid artery now. I will do it one after the other. Okay. Okay. So let me palpate your carotid artery again. I'll palpate it for 30 seconds. Okay. Okay, my patient carotid pulse is 70 beats per minute. His pulse is his pulse is regular, his pulse reading is regular, and is 2+ strong at both sides. Okay, so right now I'm going to assess my patient's spinal nerves. So can you move your head side to side for me? Okay, so you're going to move against resistance. So try and move this way for me, please. Okay, try and move this way for me, please. Okay, can you chuck your shoulders for me? Okay, I'm going to apply pressure. Okay, so my patient was able to withstand resistance from his neck, and also when I tried to chuck his shoulder, so his spinal nerve is intact. So right now I'm going to inspect my patient upper extremities. Upon inspecting his patient upper extremities, his lower extremities is supposed to be covered. Upon inspection of his upper extremity now, the skin color matches his other parts of his body and his genetic background. There is no visible lesion, there is no mass, there is no skin, there's no deformity, there's no muscle, there's no bulging of the muscle, and there is no muscle atrophy of the upper extremities. Right now I'm going to palpate his upper extremities. Okay. Okay. So I've palpated his upper extremities. His body is moist to touch, and his body is moist and is warm to touch. There's no deformity, there's no bulky muscle, there is no what will I call it, there's no muscle atrophy. So right now I'm going to check for my patient's grip strength. Can you please give me your hands? Squeeze tight, please. Okay, so my patient was able to grip my hands with equal force and strength. So right now I'm going to check for my patient's radial pulse. Okay, for 30 seconds. So my patient's radial pulse is 70 beats per minute. They are equal bilaterally, and their reading is regular, and they are 2+ strong. So right now I'm going to inspect and palpate my patient's lower extremities, and why his upper extremities should be covered at this point. So I'm inspecting my patient's lower extremities. There's no lesion, there's no bulky muscle, there's no form of deformity, there's no muscle atrophy, and there's no skeletal deformity while looking at it. And his skin color matches his other parts of his body and his genetic background. Right now I'm going to palpate his lower extremity. Okay, let me know if you feel any pain, please. Okay. Okay, upon palpation, his skin is moist and is warm to touch. There is no mass, there's no swelling, there's no bulky muscle, there's no deformity, and there is no muscle atrophy. So right now I'm going to inspect and palpate my patient posterior thorax. Can you please turn back, please? Okay, turn your back properly. So I'm inspecting his posterior thorax now. Upon inspection of his posterior thorax, the color of his skin matches every other part of his body and his genetic background. There's no lesion, there's no masses, there's no scarring, there's no swelling, there's no bulgy muscle, and there's no visible pulsation of his posterior thorax. So right now I'm going to palpate his posterior thorax. Okay, can you breathe in for me, please? Okay, so upon palpation of his posterior thorax, I could not feel any masses, any swelling, any lesion. I could not feel any deformity, and there was no and he was not in any pain as I was palpating him. And also his thorax is symmetrical. So right now I'm going to auscultate his posterior thorax. Okay, so you breathe in for me and out for me. In, out, 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 in, out. Upon auscultating his posterior thorax, I could hear the S1 and the S2 sound. That is the vesicular and bronchivesicular sound. I could not hear any wheezing, any crackling sound, and any irregular breathing sound. So right now I'm going to inspect his anterior thorax. Can you face me, please? I'm going to inspect his anterior thorax. He's not in any form of difficulty. He's not finding any difficulty in breathing, and there's no sign of respiratory distress. So right now I'm going to check for his respiration strength. So if I'm supposed to check for that, I would distract him. But okay, I pretend as if I'm checking his pulse or something. Right now I'm going to count his respiration for 30 seconds. So his respiration is 18 per minute, and he's not in any form of distress, and he was not finding it difficult in breathing. His respiration is within the border is normal. So right now I'm going to check for his apical pulse. For me to check his apical pulse, I would landmark it, and that is his midline of his supraclavicle, and he's in the 5th intercostal space. So I will count 1, 2, 3, 4, 5. So this is where it is, where the mitral valve is, and that is where I've located. This is where I'm going to check for his apical pulse, where the mitral valve is. So I'm going to count for 30 seconds. Can you breathe in and out for me? Okay. His apical pulse is 70 beats per minute, is strong and is regular, and is 2 pulse strong. Upon my auscultation, I did not hear. I heard the S1 and S2 sound. I didn't hear S3 and S4 sound, and that is expected. And his pulse was regular, and his pulse was strong. I did not hear any irregular breathing sound. So right now, can you come and lie on the bed for me? Okay, raise your legs, please. Okay, I'm going to drape him going to inspect his abdomen. So on inspecting his abdomen, I'm checking for the color. The color of his abdomen matches his other part of his body, and it suits his genetic background. His stomach is round. There is no contour. His umbilicus is midline, and there is no swelling, there is no edema, and there is no fall, and there is no lump on his stomach. So right now I'm going to auscultate before I palpate. The reason why is because I don't want to dislodge any bowel sound or cause any artificial paralysis. So I will start from the right lower quadrant and listen for the bowel sound, and that is here. So I could hear cascading sounds. Okay. The upper right quadrant. Here are irregular bowel sounds. Upper and left upper quadrant. Okay, irregular bowel sounds. Left lower quadrant. Okay, so I auscultated the 4 quadrant of his abdomen. I could hear irregular bowel sound. I could hear gargling sound. I could hear cascading sound. Okay, and I could hear 5 to 30 beats per minute. So right now I'm going to palpate his abdomen. So if you feel any pain, please let me know, because I'll be applying light pressure. So I'm starting the way I did from the right lower quadrant. Okay, right upper quadrant, left upper quadrant, left lower quadrant. Okay, so I did not feel any mass. The skin is tender. There was no his abdomen is tender, and his abdomen is there was no swelling, there was no rigidity. His stomach was none of the quadrants were swollen, none of the quadrants were protruded, and I didn't feel any mass in the abdomen. So right now I'm through with your head-to-toe assessment. You can sit down and wait for the doctor. Thank you.